Hello everyone, and welcome to another video of We Teach. My name is Sara Al-Qabbani, and today's video on headache is a collaboration with the MBRU Grand Rounds Club, who will be presenting on headache this week. We hope that this video will prepare you better for the session and will give you some information. Let's start by dividing headache into two main types. We have the primary headache and the secondary headache. Primary headaches include migraine, tension headache, and cluster headaches. They are one of the most common types of headache. Furthermore, we are not very worried about tension headache or migraines because there is no secondary underlying cause that requires treatment. However, we are worried about secondary headache, which are often caused by a more sinister cause, which requires prompt treatment. Examples of secondary headaches include meningitis, which is infection of the meninges in the brain, could be due to subarachnoid hemorrhage, due to vascular disorders, or a tumor in the brain. Let's take one example of the primary headache, which is migraine. Patients with migraines hate their lives. You can recognize them according to the pound mnemonic. P for pulsating, O for the duration or hours, so usually the migraine will last between 4 to 72 hours. U is unilateral, N is nausea, and D disabling. Why do these patients hate their lives? Usually they sit in a dark room because they can have photophobia, and they avoid loud noises. It is disabling because they cannot go to work, they can have nausea and vomiting, and it's worse with exercise. Okay, so this is an example of migraine. What are red flags? You often hear about red flags in medicine. A red flag in headache means that this headache needs further investigation and prompt management because likely there is an underlying cause that needs more urgent care. An example would be meningitis or subarachnoid hemorrhage or a tumor which needs an MRI. Therefore, when taking history, you need to look for those red flags. So what are the red flags in headache? Remember the SNOOP mnemonic. SNOOP mnemonic will allow you to take quick history while screening for those red flags. Number one is having systemic signs such as weight loss or fever. So here you're thinking about, okay, there might be a tumor or might be meningitis due to the fever. N is for neurologic symptoms such as weakness, dizziness, ataxia. O is for a new onset or a change in the character of headache. Here we are concerned about an underlying cause. Or thunderclap presentation, which is typically seen in subarachnoid hemorrhage. So sudden onset of the worst headache of their lives. Here you think about subarachnoid hemorrhage. And then P stands for papilledema, pulsatile tinnitus, positional, and precipitated by exercise. So often positional headache is related to a tumor in the brain. Papilledema tells you there's raised intracranial pressure, and you have to do, of course, further testing for that. Now, why do we do this mnemonic? Why do we ask about those red flags? Because you need to reach a diagnosis. Therefore, this summary shows you the SNOOP mnemonic, the clinical feature, and what diagnosis you want to exclude. So, for example, O, which is onset thunderclap headache, you need to worry about a bleed. Older age or more than 50 years, you think about a glaucoma, you think about temporal arteritis. So this is just a summary for you to think about as a preparation for the upcoming headache session. Headache is a very big topic that you will see in the emergency department, you will see in clinic. Many of our presentation into the family physician or primary care will be related to headache. And it's important for you to be able to take good history and drill out the red flag. Thank you very much.